Hello, I'm Michael Bowdish. I'm an adult cardiac surgeon at Cedars-Sinai Medical Center in Los Angeles. I'm the vice chair of the Department of Cardiac Surgery and serve as the chair of the STS Workforce on the Adult Cardiac Surgery database. We are in the midst of an exceptional moment in cardiac care, defined by innovation, evidence generation, and expanding possibilities for our patients. The conversation around TAVI and SAVR has matured, but several critical questions remain unanswered. 7-year data from the Evolute low-risk trial now show a clear separation in valve reintervention, favoring surgery, a signal we cannot ignore as we counsel younger patients. And patients are getting younger. Claims-based data show that 30 to 50% of patients under 65 years of age undergoing aortic valve intervention now receive a TAVI, despite low-risk trials largely excluding this group. Two populations remain particularly understudied: patients under 65 and patients with bicuspid aortic valves. We also need to consider surgical alternatives. Recent analyses from the STS National Database suggest a survival benefit for mechanical over tissue valves up to the age of 65. There are also other potential procedures for younger patients with aortic valve disease, such as the Ross procedure, which can restore a normal life expectancy. The bottom line: decisions must be individualized, honest about the evidence gaps, and grounded in long-term durability. Looking ahead, the cardiac surgeon of the future will need to be both an exceptional surgeon and a skilled interventionalist, adaptable across the full spectrum of cardiac care. Thank you.